Hi everyone and welcome to the Mother's World Show. I am Joan, your dear host. On the Mother's World Show, we talk about holistic health of the woman, whether or not you are already a mother, an expecting mother, or you hope for someday to be a mother. But at the same time, we're all inclusive and we bring in everyone within the family unit to be part of the Mother's World Show. On today's show, we're talking about awareness of hepatitis in pregnancy. I will not be alone in the studio. I have two amazing, brilliant doctors that will help shed more light on hepatitis in pregnancy. Mother's World, in collaboration with Rotaract Club of Echo Global and Rotaract E-Club of Ghana, are coming together and pushing the awareness of hepatitis in pregnancy. Do not go anywhere. When we come back, my beautiful doctors will introduce themselves and we're going to go straight into understanding hepatitis in pregnancy, but most importantly, we're here to create the awareness of hepatitis in pregnancy. I'm Joan, do not go anywhere. This is still the Mother's World Show, and we'll be right back.
Yes, hepatitis. I think during when I want to get married, we did that hepatitis test. I think we did it and it was okay. So hepatitis is just, I think it's a virus that affects the liver. And we have different types of that type of virus. We have hepatitis A, B, C, D, I think, and E. I think the most dangerous one is hepatitis B, followed by C. Although hepatitis B can also be, it can be controlled and can be cured. But I don't know about hepatitis C. I think that one is transmitted through maybe sweat or something. This is actually my third pregnancy. The first one I had, and the second one, I don't think I did anything like hepatitis test or screening. But I think this time around is included in our test run. And even though I've heard of hepatitis before, but I don't know anything about it being in pregnancy before now. I'm just getting to know. As if it's so, because this thing is not just a casual disease. It's something that is deadly. So we should be, even children are meant to even be taught in school about it, to know. So when you see someone that has maybe, children, when you see sweat, spit, they will know that this can cause such a disease. So I think the government should also include this in children's, whatever, in their curriculum in school. And also in, antenatal program, if possible, the vaccine should be given out, if possible. I learned it's expensive, but this is Nigeria, and something that we can afford. So they should make it either they make it free or they make it a lesser affordable for people to be able to run this test, and also to have the vaccine. The same way we are having COVID, during COVID time we have the vaccine. So this should be, knowing fully that it's a deadly disease, this should be something that we should have it in our system just for prevention, because nobody knows how it can easily be contacted, since it's something that can be through fluid and some all this small thing that you don't even take care of, you don't even take notice of. To make it something of importance in the country, aside from pregnancy.
I don't really feel bad about it because I'm always conscious of how I relate to people. I make sure that like other people's sweat doesn't touch mine. I think that's one of the causes. I think it will make other pregnant women to be more aware of what this disease is, so that it will be I know it's not curable, but at least it will make them to be more aware of the disease.
No, I think the awareness is poor for me not to know about it. So I think the awareness is poor and we should spread more of it. I don't feel good about it because I feel now I have to go and check Google to know more about hepatitis. So I feel like more pregnant women should be aware, including me too.
Welcome back to the Mother's World Show. Once again, I'm your favorite host, Joan, and I'm not alone in the studio, as I mentioned earlier on. I have two amazing doctors with me. I would love to introduce them, but I feel they will do better justice at introducing themselves. So welcome to the show. But first of all, on behalf of everyone and the audience of Mother's World, we'd like to say a very big thank you for gracing the show. Dr. Adedeji, we'll start with you. Please, the floor is yours. Introduce yourself.
Thank you so much for having me. I'm Adedeji Modupe. I'm a consultant gynecologist, obstetrician. I work at Lagos State University Teaching Hospital in the gynae oncology unit of the hospital. Thank you.
Dr. Rachel.
Thank you very much. My name is Dr. Rieninwa and I'm a medical doctor. I work currently as a house officer in Lasut. I'm also the president of Rotaract Club Eco Global, and I'm a preventive health advocate, and I run a program, Outreach Up. You can check it on Instagram. Thank you.
It's such a pleasure to have very sound doctor, you're a senior doctor. You know, you've been in the medical field for years, and I love the fact that I see young people in the medical field, so I feel seen and represented. It's such a wonderful thing. But the reason why we're here today, guys, it's one important thing, basically to raise awareness for hepatitis in pregnancy. And when this awareness theme came to my table, I did some research, okay, and I realized that over 80% of infected Nigerians do not know that they actually have hepatitis. And I'm pretty sure in that 80% they are women, and they are pregnant women or women that hope to be pregnant one day. So we have, when I say we, the audience and I, we have a series of questions, you know, to really understand what this hepatitis is and the effect of the role it plays during pregnancy, to be specific. So the first question is, what should every woman do, whether or not we're pregnant, about hepatitis, and how does it actually affect the reproductive health in totality?
Okay, thank you very much. Yes, I will first of all want to educate us that hepatitis on itself, it's a diagnosis of something is wrong with the liver. And what is wrong with the liver is that there is inflammation ongoing. And we use the word hepa as liver. Let's say Latin word. I'm not sure about that. Or Greek. I think it's Latin.
Yeah, Latin.
Okay. Latin word as hepa. So is that something is going on, and inflammation is going on in the liver. And there are factors that can cause that. It can be infectious, it can be through toxins, and it can even be the body fighting itself, like autoimmune. So what is quite popular amongst us is using hepatitis for the infectious one, commonly viral. It can even be bacteria. So the one that is most common amongst I would like to talk about that could be prevented, because others may not be easy to prevent, it can happen by itself. Like the one I said, like the body fighting itself, autoimmune, just some immunity fighting on liver, you know. Then the toxins, our way of life, lifestyle, too much alcohol, too much of some chemicals and all that. So causing inflammation in the liver. So the one that I know you're interested in is the one caused popularly by virus, which we think we can prevent, even though we may not be able to cure, and also limit the complications that can come from it. So we have viral hepatitis caused by different subtypes of types A, B, C, D, E, even F. Yes. So what is most popular amidst is the hepatitis B that we talk about, even the hepatitis C as well, which we know that can be contacted just like HIV by blood contact, body fluid contact, and the rest. So it's a lot of noise because of its way of being contacted, and then the complication at the extreme, liver cancer, that it can be responsible for. So if we can prevent it, then we reduce the mortality from developing cancer in the future. Yeah.
I just heard like hepatitis with so many alphabets.
There's even G.
G.
Yes.
And I heard something about not being incurable. So let's just burst the bubble in a friendly way. You said it can be managed, but it can't. Is it all the would I call it strains of hepatitis that's incurable, or can some at least be cured?
Okay, so let me modify. For those that are caused by identifiable pathogens, like maybe bacteria, really, the common one is viral. We can say that yes, we give some antibiotics and probably cure. But what we usually talk about is the viral, and we know that virus really does not have a cure. When we all remember coronavirus, blah, 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 and all that. Yes. So, but there are some that even run their course as a viral infection, just like having catarrh. Yes. You know, really, there's no direct drug for catarrh. It runs its course, may not use anything, not even vitamin C. It goes away. So we have acute forms of hepatitis. We have chronic forms. Talking about viral types now, chronic forms. So those acute forms may even come in without you noticing. No, not I mean, the chronic one can be there without you noticing until you come out for a test or something and you are told. Then the acute one, yes, that one actually breaks down. You feel weak, you feel tired, you know, and everybody goes around treating malaria. Then you get to the hospital and they are told that there is something going on. Most especially the fact that probably the eyes is yellow, you know, probably been stooling, and everybody is saying malaria. So that's why we always try to educate populace that not every fever is malaria. In fact, some people don't even look at fever, just some form of weakness, and the next thing it is malaria. And the next place you are going to is that
alternative.
Not even the alternative. Chemists. Those that do roadside selling and go to some pharmacists, and then you tell the pharmacist that you have malaria, and they will sell you malaria medications and all that. So most of the time it's not malaria. So it's when you get to the hospital that then we'll see you, and then the first thing too is that you want us to quickly run some tests. But the truth of the matter, interacting with you, examining you, it's 90% of the time we get our diagnosis. The test we do is actually to confirm and also to help us with further management if necessary, and writing drugs may not also be immediately until the results that comes out and all that. So that's it. So that's when it is acute hepatitis. And then with a chronic, most of the time you may not know, and that's why, yes, because yes, you may have had an acute phase and been the type that treated malaria in quotes, and then it runs its course, you are better and all that, and then it is when you now come to the hospital or you want to even do a blood transfusion. You want to do a blood donation, and then you just run the test and you are told that you have hepatitis B or hepatitis C, and then the question is, where did I get it from? But I'm not sick. Are you serious? You know. Wow. So that's the chronic type. Chronic does not mean it's painful or it's severe, you're about to die. It just means that it's long standing. So something is in your body and it is long standing. Yes.
And it's not obvious.
It's not obvious. Some people have hepatitis B for a long period, and it's only detected when we are making diagnosis of liver cirrhosis, making diagnosis of cancer of the liver, and then we're just like, let's check for hepatitis B, and then the result comes out positive. So it must have been there for a long time.
Dr. Rachel, you're talking about a vertical thing, something being passed from mother to child. So before we woke Cam, we were speaking about that, and there's a question here that can hepatitis be passed from a mother to her baby? And if yes, how early should expectant mothers get tested? And why is timing critical? Because I heard you talk about preventive medicine.
Yes, thank you very much. Thank you for having me. So, like I said, by the hepatitis, it's a virus, just like the way HIV, AIDS, it's a virus. It can be transmitted from mother to child. And when it's being transmitted, it's called vertical transmission. I don't think the audience really need to know much details about that. But how early, because we are in mother's world, we need to equip our women out there, equip our pregnant mothers out there. How early should we go if you feel like, okay, you want to catch this on time? And like my senior colleague had said, it can be there, chronic, especially hepatitis B. Our major focus is hepatitis B because that's the one that you might not easily detect. You might be living fine. She also said you think it's malaria, your body will be weak, you'll be stooling, you feel fever, please you go to chemist, please, and then it will mask the effect. And then liver has this way of getting to 80% damage before you can even pick something up. But we have things like early antenatal routine. So once you feel like you are married or you are sexually active, let's be honest, and you did not do the proper safe sex, and you know that you feel symptoms of pregnancy, go to the hospital. Every woman, whenever they feel any form of symptoms, as little as body weakness, it is proper you run a pregnancy test. Am I correct?
Yeah, yes.
You run a pregnancy test because you never can tell that you are pregnant. Then from there, you then go to antenatal from about 8 weeks to 12 weeks. You can register for antenatal after confirming your pregnancy through a blood test. And it is mandatory, especially in public hospitals or health centers, when you are going for antenatal. We call it booking. Are you booked? They run HIV, hepatitis, syphilis. It's syphilis and and the other things. They also check your blood level, which is very important, so that they would know how to start managing it. And once it's detected, you can prevent that from going into the child. Yes, we know that we have a placenta connection to the baby, but with proper drug treatment, and then if the woman is discovered to be hepatitis B, there's something we do, viral load.
Okay.
So if the viral load is below a certain level, and that's the recommended level, we might not necessarily start those drugs, because we also want to be mindful of the toxicity to the baby. And there are special drugs we use, rather the fetus. We don't call it baby until it's born, the fetus. So, but if we see that this viral load is too much, and the fetus is already there, you have to start those medications. So it reduces the viral load, and then you can hope for like a 80 to 90% chance of the child not having. And even if you still have your doubts, once the child is delivered, between 24 to 48 hours, there is what we call hepatitis immunoglobulin that is given to the baby, and then other vaccines that will be given.
Wow. Now, you were saying that sometimes hepatitis, people will live with it and not even know. And you said something about how hepatitis is so good at masking, itself. I would call it a chameleon in the system based on how you've described it. Now, we're going to go on a short break in about 2 minutes, but real quick, what are some of the silent symptoms of hepatitis during pregnancy that women might just ignore or mistake as, this is another pregnancy symptom?
Okay. So it actually behaves the same way even outside pregnancy, just as exactly as I described earlier. And that's usually the acute phase. I try to differentiate what acute and chronic is. So most of the time, really, they present to us with no symptoms at all. As she has said, because of the routine checks we do at booking, which is usually when a woman misses at 2 cycles, we kind of educate them to register for antenatal. It's because at that point there are so many things that are supposed to be done. Some of our health maintenance organization, that's HMO, want to encourage them to come right after them, maybe around 12 weeks and beyond. Then we would have had other things, the one they will not be able to benefit from so many other things that they would have benefited from and all that. So at that point, that was when we pick up the fact that they are hepatitis B. As she has said, we are interested in the B, even the C as well. But we talk more about this B most of the time. But the B and C, we are and it's because of the means of transmission. And what we are really also trying to prevent is the vertical transmission. When we talk about vertical transmission, as she has said, is from the mother to the fetus. So, and then like that, because the very common way to have the hepatitis is really actually through that means.
Yes.
And that informs us about the long time carrying of the virus. Maybe you even had it when your mother had you. Yes. So that's why at the end of the day, you may have to even go back home and say maybe your mom should check, and she's not come down with anything. So after that, we are interested in if the person is also a carrier. So we do further tests to identify that, oh, you have it. Or no, I mean, if the person is infective. So we do further tests to find out if that, though you have hepatitis B, you are carrying it, are you actually infective? So there's a test we do also to do that, and then we'll know that you can infect the child. So we pay attention to probably when you come down with some symptoms and rule out every other reasons, then probably yes, it is hepatitis, and then we need to treat. Most of the time we treat along with gastroenterologists. So those are other specialties that take care of, doctors that specialize in taking care of sicknesses, ailments of the gastrointestinal system. That means from our mouth down to the anus, involving the liver and every other thing that comes with the liver, bowel and all of that, bowel ducts and all of that. So there's that specialty there. So then they will help determine if patient has to go on antiviral drugs, which is not a cure, as she has said, to help reduce the load, also to reduce the risk of transmission, and also to also manage the woman as it were. So most of the time, the presentation to us is usually chronic, coming for antenatal, running your tests, and finding out that you are positive. There's a surprise, then we'll go further to find out, are you infective? Can you infect the next person? Can you infect, even want to ask that your spouse should also run the test and all that. They will carry along with baby is delivered, what should do to the baby and all that to prevent transmission in the community.
So from everything you've described, because we're going to go on a short break, it sounds like the baby brother of HIV. It sounds like the baby brother.
I should even surprise you. The point is that you can easily have hepatitis, that's virus, I've separated everything. Yes. Easily, even more than HIV.
Yes.
This is like the stubborn baby brother that just doesn't want to stay in place.
Like the silence. I don't even know.
Because from everything you described, like someone can have hepatitis.
Probably worse, because with HIV, it keeps announcing itself. Initially, when you get infected, you feel sick. You have some of those symptoms that will make us check for HIV. I know that probably may even bring you to the hospital.
Yes.
Yes. And then if you don't do this and this for some few period along the line, you start having everything that shows that your immunity has been broken down. Compared to hepatitis, I just doing this thing.
Just chilling.
In the liver.
Dealing with the liver.
Dealing with the liver meticulously.
Yes. And what happens when we say hepatitis, I said inflammation.
Yes.
So that means there are some processes going on in the liver, breaking down, and then the liver is trying to fight healing itself. So it causes what we call scar. The scar. That is happening on the liver, and all that is going on. The scarring of the liver is what we eventually call liver cirrhosis. So the processes of the healing and all that eventually results into the hepatocellular cancer, so to say. So that's about that. So I wish we had the gastroenterologist on board. It would have helped us more in that line. But we are paying attention to the women during their pregnancy and also their newborn.
Wow. Okay, let's go on a quick short break. I am sure that you're not going to go anywhere. After everything you've heard, I dare you to go anywhere. You're not. You're going to stay right there because we're coming back and you're going to know more about hepatitis, because this is about raising awareness of hepatitis in pregnancy, and this information will help you and you can help the next person. This is the Mother's World Show. Definitely don't go anywhere because we'll be right back.